So today, guys, what we are going to talk about is the pancreatic injury. So I'm Dr. Pawan, and in this session, what we are going to cover is a pancreatic injury. Okay, so let's start by talking about it. Okay, now let's first start by talking about the incidence. Okay, so what do you think? Is it like a very, very common type of an injury? No, it's really not that common. Okay, so 7 to 10% of all the abdominal traumas in a polytrauma patients may have a component of a what we call as a pancreatic injury. So it's not that common, but it is something for which you have to be a bit vigilant. Okay. Injuries to the pancreas occurs in approximately 5% of the patients of the blunt abdominal trauma and 6% of the patients with a gunshot wound to the abdomen. So in the blunt trauma and in the overall, if you see, it is more common in the blunt trauma. Okay. So what they say that 6% of the gunshot wound and 2% of the stab wound. So overall, it is more common after the blunt trauma as compared to that of the penetrating. So more or less, you can say that they are 5% each. But yeah, like in the blunt trauma, it can happen in the penetrating as well. In the penetrating, gunshot wound is something which leads to 6% of the total pancreatic injuries, and the stab wound, it basically needs to around 2%. Okay. Now, the reported incidence is close to it's from 0.4 to let's say 12%. That's different, varies depending on the different areas and different cultures and different backgrounds and everything. Okay. Now, let's talk about the mortality. Now, is it like something to be worried about? Well, what you need to understand is that there are various vasculatures which are present near the pancreas. So, there is a good chance that if at all some major vessel has been injured, that within 48 hours, the patients might die. Okay, so most of the mortality, if it has to happen, it happens within first 48 hours due to the acute hemorrhage of the traumatized vasculature, including the splenic vein, the portal vein, the inferior vena cava. Okay, so in these particular patients, the patients can die because of exsanguination, because of the bleeding. Because if at all there is the injury to the splenic vein, portal vein, or the inferior vena cava, the patients can die. Now, patients surviving in the initial hemorrhage, okay, even if let's say there is some kind of bleeding and the patients have survived it, many of these particular patients later may develop something which is called as an pancreatic abscess or a fistula or a pseudocyst or a false aneurysm. Okay, so that is what you need to understand, that if at all there is a significant amount of bleeding and the patient has survived that, you have to be vigilant for these particular complications in the later part of it. Okay, so in the later part of the management of the patient, you have to be vigilant for the abscess, the fistula, the pseudocyst, the false aneurysms of the arteries, and anastomotic leak as well. Okay, now coming to the pancreatic injury. So, is isolated pancreatic injury common? No, it is not that common. So, there are various organs which are located around this particular pancreas. So, anteriorly, you have the transverse colon, and posteriorly, there are the kidneys, there's a renal artery, there is a various other things which are present. So, isolated pancreatic injuries are very less common. And also, the duodenum is very, very closely related to this particular pancreas. So, duodenal injury can also happen along with this particular pancreatic injury. So, that is what duodenum because of its proximity. So, the second and the third part of the duodenum are very closely related to the pancreas, and the injury to the pancreas can be associated with the injury to the second and the third part of the duodenum as well. Now, when you talk about the relation, anteriorly, the patient has a transverse colon and attachment of the transverse mesocolon and the lesser sac and the stomach. Okay, so anteriorly, what do we have? We have this transverse colon, attachment of the transverse mesocolon, stomach. Yeah, so these particular things are basically present anteriorly and the lesser sac. Okay, now what about posteriorly? So posteriorly, there are quite a lot of things which are there. Okay. Okay. Hi, Tanya. Good to have you. Okay, good. So we are talking about the pancreatic injury today. Okay. So we were talking about the relations, like what are the structures which are basically present anteriorly and the posteriorly. So anteriorly, as I told you, that we have the transverse colon, then we have attachment of the mesentery, then we have the stomach and the lesser sac. These are the things which are basically anterior relationship of the pancreas. Posteriorly, there is also there is a bile duct, there is a portal and the splenic veins, there is an inferior vena cava, aorta. So a lot of vasculatures are basically present posterior to this particular pancreas. Origin of the supreme mesenteric artery, we have a psoas muscle, then we have a adrenal gland, we have a kidneys and the hilum of the spleen. So all these are the structures which are present posteriorly. So posteriorly, mainly we have the vasculature. And if at all there is an injury to these particular vasculatures, there is a chance that the patients might die. Okay, I mean, if at all there is a significant bleeding, that is one of the most common reason for the patients to die within 48 hours from the start of that particular injury. Okay, now moving ahead. So what are the causes? Like now we are talking about the clinical aspects of it. So this is very, very important, and let's kind of spend some time over here. So whenever we deal with any particular patient, we have something which is called as a mist. Okay, so what is this mist? Uh, Okay, what is this particular mist? Mist is basically the mechanism of injury. M basically stands for the mechanism of injury. So we need to kind of understand what was the mechanism of injury behind that particular trauma. Okay, so in the road traffic accident, okay, so in the mechanism of injury, if at all, the history basically is there that the patient was stuck between the steering wheel and the car seat, okay, for a prolonged period of time. Then what is going to happen? This poor pancreas is going to get compressed between the steering wheel and the seat. Okay, so steering wheel injury, it leads to the injury, like pancreas gets injured at the neck more as compared to that of the body. So the neck injuries of the pancreas are caused because of the steering wheel injury. We'll talk about that. I'll share the image as well. Now, fall from height, okay, that can lead to that, and penetrating injury. So if at all there is a penetrating trauma with the gunshot or with the stab injury, it is equally present. Like the body and whatever the head and the tail, they are equally kind of affected by this penetrating injuries. Okay. Now, in the children, okay, the mechanism of injury, as I was trying to tell you, direct compression of the epigastric against the vertebral column kind of varies according to the age of the patient. So if at all we are dealing with an adult, they are going to have a lot of fat and a lot of connective tissue and everything. But when we are talking about a very lean, thin person, or let's say we are talking about the children, in them, there's not so significant amount of padding to that particular pancreas. So it is very easy for that pancreatic tissue to get compressed between the vertebral column and anything hard, which is coming and kind of fitting to the epigastrium. I'll give you the example for that. For example, in the infants and children, child abuse, if at all somebody kind of punches them, then yes, pancreas can get injured, and bicycle handlebar injury. Now, this is something which is very, very common. Let's look at the image and understand this. So let's say if at all this particular child is kind of driving a bicycle and he falls down. This bicycle bar can hit the epigastrium of this particular patient. So what's going to happen? This pancreatic tissue, the neck of the pancreas, it will get compressed between this vertebral column and this bicycle bar. And there can be injury to this particular part of the pancreas. So this is a mechanism of injury in the blunt trauma to the pancreas. Okay, so this is a mechanism of injury for the blunt trauma of the pancreas. Similarly, if at all there is a steering wheel, in the steering wheel also what is going to happen, that the steering wheel is going to compress this pancreatic tissue between the vertebral column and the steering wheel. So again, leading to an injury to the neck of the pancreas. I hope you have understood this point. Okay, so this is the mechanism. And the adults, road traffic accident and the penetrating injury, that can lead to that. The most common in the children and the young adults because of the decreased intra-abdominal fat. As I told you, that if at all you have a good amount of intra-abdominal fat, then the chances of the pancreatic injuries are very, very less because it will not get compressed between the vertebral column and anything what is hitting your epigastrium. Are you understanding? So if at all we are talking about the young children or very, very lean thin people, in them, this kind of an injury will occur more common. Okay. So that's all about the mechanism and everything. Now, diagnosis. Now, how do you exactly diagnose the patients with a pancreatic injury? Okay, so there are various investigations which we do. The preferred investigation which we usually do is CT scan. Okay, contrast-enhanced CT scan. That is what is the preferred investigation for the retroperitoneum for the pancreas. But the sensitivity and the specificity of that varies from different studies, but it is somewhere between 60 to 80%. Okay, so diagnosis, identification of the pancreatic injury can be challenging, particularly because of the available imaging modalities are not highly effective. Okay, based on the technology, blah, 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 60% it's kind of there, which can detect you the duct disruption. This disruption remained below 60%. Okay, this Pittsburgh and this, they performed a CT prospective study with the sensitivity of around 80%. So you can say that the CT scan is good, like decent enough to diagnose at least the parenchymal injuries, but in order to tell us the ductal defect, whether the duct have been injured or not, the CT scan is not that effective, but it's somewhere around 60 to 80% or something like that. Okay, but still CT scan is the modality of choice because it is relatively easily available and yeah, that's and easy to be done, fast to be done. So that is and relatively cheaper. So CT scan is the modality of choice for now. Okay, the findings, what you can find is a peripancreatic hematoma. So you can have a hematoma around the pancreas. You can have a free fluid in the lesser sac. Okay, so you can have collection of the fluid